Sawadee good afternoon once again, and thank you to Dr. Tui Sin for the Thai language version of the briefing just now. Today is Friday, the 11th of February 2022, and this is the English language summary of the press briefing here at the Center for COVID Situation Administration, or CCSA. So first of all, I'd just like to mention a few issues that Dr. Tui Sin mentioned. First was the highlight on education, on the educational institutions, in which the on-site scheme of teaching is something that the authorities are looking very much into, especially in the provinces. Of course, there's a difference between online and on-site. However, the schools which would be open for on-site learning would have to follow the various important measures that we have put in place. Secondly, about the donations of vaccines. Just to mention first that there are plans that Thailand will be donating certain vaccines to various countries, as well as plans which have already happened already in terms of receiving assistance from other countries. So both ways actually. But in general, in receiving vaccines from other countries, mostly we receive Sinovac and Pfizer from various countries, and that's ongoing. At the same time, we have plans to donate more vaccines to other countries. Mostly that would be AstraZeneca donations to our neighboring countries, as well as other developing countries in various other continents. Now, just a summary of the Thai briefing that we had just now on the global situation. Firstly, the new infection cases is now globally on a downward trend, as well as the overall number of new cases in Europe and the Americas. On the contrary, numbers of new cases in Asia seems to be on the rise again. The global fatality rate remains stable. For the situation in Thailand, with the recent rising number of cases, the CCSA today was reassured that our healthcare system is still intact. Now, as you would know, we had the general CCSA meeting this morning. The number of hospital beds used for severe cases nationwide account for 12.1% of the overall available beds, while supply of COVID medicine, namely Favipiravir and Remdesivir, remain sufficient. However, those infected without symptoms or with mild symptoms will be treated under home isolation, and may register with the National Health Security Office, or NHSO, for home isolation arrangement by contacting 1330. Just an update on the arrival of travelers, entry into Thailand. We'll have some slides on full screen for you. During the 1st to the 10th of February 2022, we have around 55,823 travelers entering Thailand. And of this number, 23,036 travelers continued to enter via the Test and Go, or the quarantine exemption scheme, and 27,667 entered via the Sandbox scheme, with 5,120 entering through the quarantine. Out of the total number of travelers, we have 1,832 testing positive for COVID, or 3.28%. The majority of international travelers come from these top 10 countries of origin, and you see that on screen now. That was from the 1st to the 10th of February. And before we go to the next section, just to share with you that the Thailand Pass Helpline for travelers entering Thailand, you have a QR code there on screen for the helpline. Contact points which you may reach out to in case you have further inquiries on the Thailand Pass. On the general situation, we remain at number 30th in the world ranking for the number of COVID-19 cases. New confirmed case, 15,242. Active cases, a bit on the rise, 111,393. We have new recoveries at 8,955, 23 new fatalities. And the fatality rate now stands at 0.87%. Now, of the 23 fatalities today, most are in the elderly group, and some cases are cases with congenital diseases. And as fatalities are still from the vulnerable groups, we continue to advocate for the prioritization of vaccination for these groups. And now for the top 10 provinces with COVID cases on screen. As usual, in green it means less than the previous day, and red is more than the previous day. I'll just let you have a look there in case some of the English language audience live in these particular provinces, so you can keep tab on the trend of the number of new cases each day, each week in your particular area. Now, with the spike in the number of cases, it would be a good time to review current guidelines for high-risk contact. Now, this high-risk contact is provided by the Department of Disease Control. So, high-risk contact, or in short, HRC, this refers to those who are exposed to infected persons without wearing masks or without practicing hygiene or without personal protective equipment or PPEs, and having one of these following conditions as well: close contact with an infected person, probable or confirmed case on the day of that person displayed symptoms, or within 3 days before that person displayed symptoms, or stayed close to or talked to infected persons within 2 meters for more than 5 minutes, or were coughed or sneezed on, or stayed in an unventilated area with infected persons for more than 30 minutes. Now, so any one of these 3 scenarios without wearing masks, you would be a high-risk contact. Please note that probable case means a positive ATK result, and confirmed case means positive RT-PCR result. Probable case and confirmed case. That's the difference between the terminology. And once you are a high-risk contact, the guidelines tell you to proceed to home quarantine for 7 days. During quarantine, you should wear masks at all times if you are unable to be completely isolated. Check your symptoms every day and take the first ATK test on the first day that symptoms begin, or on the day 5 and 6 after your last contact with the infected person. If the ATK result is positive, please call the National Health Security Office, or NHSO, for home isolation arrangement. And after 7 days of home quarantine, the guidelines provide that you'd be self-monitoring for 3 days. This means you may go back to work if necessary, but you should also follow universal prevention and try to avoid crowded places, crowded public areas such as markets, department stores, and public transportation. After the second ATK test on day 10 with a negative result, you may resume normal activity while still practicing universal prevention. Now we go to the vaccination progress. Can we have the slide on a full screen so people can see? Slide on full screen, please. So yesterday, we administered 514,227 doses of vaccines, increasing the accumulated number of vaccinations to over 119 million doses. This brings us to 75.7%, over 52.6 million people of Thailand's population which have received their first dose, and 70.6%, or 49 million people, who have received their second dose, and 24.8%, over 17 million people, who have received their third dose. The CCSA today also noted recommendations by the Ministry of Public Health, a new vaccine combination for children aged 6 to 17 years, which is Sinovac and Pfizer. So just a quick update on the Thailand Digital Health Pass before closing today. The European Union, or EU, recognized the Thailand Digital Health Pass, or the MALPROM, on the MALPROM application. The Thailand Digital Health Pass on the MALPROM application. This pass, which shows the record of vaccinations, RT-PCR and ATK screening results, as well as the records of the holders' infections and recovery from the virus, is equivalent to the EU Digital COVID Certificate, or EUDCC. So that recognition has been placed with the Thailand Digital Health Pass. This Thailand Digital Health Pass can be used to enter EU countries and 33 other countries and territories which have links with our system. and to participate in activities or use services at venues in those countries and territories. And lastly, for those planning to meet up with family and friends this weekend, the good news is that the CCSA General Meeting today maintains that alcoholic beverages may be served until 11 p.m. For your own safety, please continue to observe universal prevention, as well as make sure to use only restaurants with the SHA Plus or Thai Stop COVID 2 Plus standards. Do be mindful that the restaurants or any service you use follows the COVID-free setting measures put in place. So that's all I have for you today. Thank you for your attention. Have a great weekend, and we'll see you again on Monday. สวัสดีครับ
ครับขอบพระคุณนะครับท่าน